So this is the traction splint skill. The contraindications would be any injury above the midshaft of the femur or below the midshaft of the femur. The indications are swelling, tenderness, deformity at the midshaft of the femur. So to start out, I would hold stabilization above and below the injured site while my partner checks CMS on the injured leg's foot.
Don't mind touching.
And then he would apply the ankle strap while I'm holding stabilization. And then after he does that, he's gonna pull manual traction until, if the patient's conscious, until the patient feels relief. While he's doing that and the injured side is stabilized with the manual traction, I would come on the other side and I would measure the traction splint on the uninjured leg, putting the top black handle at the ischial tuberosity, and then the bottom part, you want it 8 to 12 inches past the foot. That's the right length. So right about there is about 8 inches. So then once we're done there, and it's all measured out, I would come to the other side, kind of place it next to it, and then we would, if you could lift it up a little bit, keep it as steady as possible, and put the traction splint underneath. And then we would tie the top one around his bikini line, or her bikini line. Making sure it's nice and tight. And then we would attach this to the metal part, and we would apply traction. While we're doing that, I'll get all my straps ready. The first two straps you want at 2 fingers above and below the knee. So about right there. You want one on the upper thigh. And these two first, above and below the knee. And then the last one is the ankle to make sure it's nice and secure. And then when that's all done, you would check CMS of the foot again to make sure that we didn't cut off any circulation. And that is the traction splint skill.